So in this part of our video series, I will just demonstrate with a brief overview the two main components of our ECG setup. The first one is the portable printer, which I will start with this one. It's very simple to start it. We just press the power on button, and here we can see that the printer has an indicator of battery status and the Bluetooth icon, which is not connected in this case. When we want to load the paper, the ECG paper, we just press down on the button here, and we can see that the compartment is exposed, so we can insert the appropriate compatible ECG paper, thermal paper. So we just press down after we have inserted it, and it's ready to operate. We will then boot up the main part of this demonstration, which is the ECG machine, and we will await for it to turn on. Probably we will see that the connection will be established as soon as we see the main screen. This is because I have already set up the pairing earlier. So we can see the main screen, which is the typical ECG 12 lead and rhythm lead monitor. Of course, since no patient is connected, we just see an isoelectric line. I will just show you the different parts of this screen. Here we can see the current date and time. We can see the battery status of the ECG machine, and here we can see the Bluetooth status, which is connected, and the printer is also connected. Here we have a symbol which is yellow or green, and demonstrates if some of the leads are improperly connected or there's no good connection. So I will just press it, and we see all the appropriate places of the ECG leads on the patient's body. So here is the heart rate indicator, which of course shows the heart rate of a patient per minute, and this is the ID that we have inserted for our patient. We can change this by pressing on it, and here we see the main patient data screen, where we can type the different demographics, like last name, first name, gender, and other information that is required from us. And then we just press OK, and it will go back to the original screen, which is this one. Of course, if we have some patients assigned to certain barcodes, like in a hospital or a clinic, we can use the camera, which is part of the ECG machine, by just pressing this button, and the camera is being activated. As you can see, we can read barcodes. So we have down here we have the main options, which is real-time recording, the low pass, the format, which we can change it to 12 leads simultaneously, 6x2, 6x2 and one rhythm. It all depends on our preferences. With this button we can freeze the recording that we have acquired so far, and we can analyze it, we can save it, we can print it, we can also see the diagnosis. By pressing start, we can start recording a short 10-second strip of the patient, and by pressing file we can enter the saved data of the different patients that we have in our archive. I'm not pressing this since we have some sensitive data inside. And this is the main settings screen. I will just show you the setup part, which shows all the main options of the ECG machine. The first one is the basic ECG setup, which has some, let's go through some of the options. The lead standards, or the lead sequence, like the standard of the Cabrera sequence, the filters, the way the ECG is displayed, the thresholds for the arrhythmia, and some other options as well. Then we have the patient info screen, which we can, just by pressing these little boxes, choose which information will be displayed regarding the patients. Then the sampling setup, which has also setups as well for pharmacological uses of the ECG machine during some examinations, the sampling times, the RR intervals, and so on. Then we have the recording setup. This has mainly to do with the printer, which we can see we have the print setup, which has the print device. This is the main point where we choose the printer. So in this case I've connected the Bluetooth printer, but we can click here and choose a USB printer or a network printer. In the case where we choose a network printer, all we have to do, which I have already tried, is input the network IP of the printer and the port, and we can send our reports for immediate printing. Here is the screen for the various communication options set up. We can use mobile networks, we can use wireless, Bluetooth or Ethernet setup, and of course the different information regarding ports, IP addresses, and so on. And finally, I'll just show you the system setup, which has the options regarding display, sound, volume. For example, you can alter the display brightness. We can turn on and off the various tones, beeps. Here is also the date and time setup, and some other setups regarding the names, if we want to input institution names, PDF names, and so on. And here you can see also that the device has a capability of 24 gigabytes of space, which I have already occupied 2 gigabytes. And this is the brief introduction of this beautiful and useful ECG machine, which is quite portable and useful for any clinician. Thank you very much.